Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps, including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Virginia Audio Collective and the World Podcast Network. Podcast episodes also air Sundays at 10 a.m. on 100.5 FM, 92.7 FM, and 820 a.m. across Central Virginia, 1650 a.m. in Hampton Roads, and 105.1 FM and 1050 a.m. in Lynchburg. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. And today, we're pleased to be joined by Dr. Kareem Zaki, a urologist with Twin County Regional Healthcare, a LifePoint Health facility in Galax, Virginia, for a conversation about his work and career, new advancements in robotic therapy, and more. So with that, welcome to the show, Dr. Zaki. Thank you for being with us.
Thanks for having me, Julian.
Well, we appreciate it. We like to start these conversations by getting to know our guests a bit better. What we know is that you earned your medical degree from the VCU School of Medicine, and you specialize in urology. Beyond those few details, we'd like you to share with people a little bit more about your life journey and your unique personal story.
I'll be glad to. Give you an idea, I've been in Virginia for almost 40 years, went to medical school here, but I also did my college at William & Mary in Williamsburg, so I feel like I'm a native Virginian. And I've been in Richmond and Blacksburg before I came to Galax about 20 years ago, and I've been here in this community for the last 20 years. As you said, I am a urologist by training, and that covers the surgical and the medical practice of urology in all its facets. I'm a general urologist per se. I don't have any subspecialty niches. I take care of pretty much everything that needs to be taken care of for our community except for very specialized care. We are fortunate to have big medical centers near us that give the helping hand when we need to do so.
I appreciate you sharing that, and that description actually is a great segue to our next question, which is about urology, which, as you mentioned, is a medical specialty focused on diagnosing and treating conditions of the urinary tract, the bladder, conditions, kidney stones, and the male reproductive system. We're recording with Dr. Zaki in May, but June is Men's Health Month, which provides an opportunity to remind people of the importance of prostate checks and other preventative screenings men should have. As men age, many may experience an enlarged prostate or even prostate cancer, which affects 1 in 8 men. Dr. Zaki, I'm proud to share that as a man in my late 40s, I've had my prostate checked recently. As we look ahead to Men's Health Month, what message would you like to share about taking the appropriate steps to protect personal health?
I think you hit the nail on the head there. Certainly, for younger men, testicular self-exams, are important. We kind of advise younger men, kind of like we advise younger and older ladies do self-breast examination. Self-testicular exams are something I encourage. God forbid you feel a lump or something doesn't belong. Unfortunately, testicular cancer is one of those things that hits young people, mostly, teenagers to mid-30s, and those are things that need to be addressed as quickly as you identify a problem. In terms of the older population, I think a lot of guys assume that getting older means you're going to have problems with urination and they sort of just grin and bear it. I recommend highly that they don't do that. It's not just enough to say, oh, it's because I'm getting old. They need to have somebody look into it. The other thing, of course, is prostate cancer screening. Generally, the American Urologic Association doesn't recommend, screening with PSA, which is a blood test to look for prostate cancer concerns until you're age 50. If you have a strong family history, you should start that screening at age 40. By that, I mean if you have, a father and a grandfather, a couple of uncles, or a brother with prostate cancer, especially if they develop that diagnosis at an early age, those are the folks that likelihood have a genetic predisposition for early onset prostate adenocarcinoma, and they should be getting a treatment plan quickly as possible for diagnosis as early as possible, and that means their screening starts at age 40 as opposed to the 50-year-old for general population.
And we're talking about men's health and prostate health, which you were just referencing, Dr. Zaki. Twin County Regional Healthcare is offering a new robotic therapy for the treatment of lower urinary tract symptoms due to benign prostatic hyperplasia, or BPH, which is a non-cancerous condition whose symptoms can include difficulty or frequent urination. The statistics indicate that 1 in 2 men ages 51 to 60 have BPH, and the incidences increase over time. I wonder if you could provide more of an overview of BPH and its health implications.
Absolutely. As you mentioned, it's a very common problem. And as most of us men get older, especially after age 50, we all experience a difference in our urination or voiding habits. Some of us start getting up at night more than once. Occasionally you notice like a weakening of the stream or the force of the stream. That's accompanied by sometimes what we call overactive bladder symptoms, because bladder muscles is working overtime and it gets somewhat thickened or hypertrophic, as we call it. You can also develop bladder spasms, and that would include urgency and frequency of urination on top of the other things we discussed. And that's generally related to an enlargement of the prostate. And as you mentioned, this is not a malignant enlargement. This is a benign adenohypertrophy. Adeno means that this is a glandular event. As the prostate ages, the glands hypertrophy, and the prostate will somehow cause extrinsic compression to the part of the urethra or the voiding channel that is incorporated or goes through the prostate. And when that happens, you have an outlet restriction or obstruction, rendering the bladder having to work extra hard to pump that urine past that restriction. That's what they mean by benign prostate hypertrophy causing outlet obstruction of the bladder. And of course, that's, there's different treatment options from medical to surgical, and we can discuss those if you wish.
Absolutely. And that's my next question, which is that Twin County Regional Healthcare is offering a new robotic therapy for the treatment of lower urinary tract symptoms due to BPH. This procedure involves aquablation therapy performed using a surgical robot to assist in precision tissue removal. This sounds like a pretty high-tech process that involves real-time multi-dimensional imaging, automated robotics, and a heat-free water jet ablation for targeted removal of prostate tissue. So if you would, Dr. Zaki, can you tell us more about this process?
So traditionally, when you have a patient coming in that says, I'm having obstructive voiding symptoms along with some of those irritative symptoms that we discussed, and we kind of hone down to the prostate being the culprit, we would start a workup that requires, visualization of that area of the urethra or the voiding channel that goes through the prostate, examine the bladder, and measure the gland or the prostate size, because those are things that are going to ultimately involve the best definitive treatment option, recommendation, or advice we give the patients. Because we have more than one option available to us. In the distant history, maybe 50, 60 years ago, a transurethral resection of the prostate, or a TURP, was sort of the most commonly performed surgical procedure in the United States, because everybody that had an enlarged prostate, that had any concerns or symptoms, had a TURP. The problem with resecting the prostate at that point is because there was a monopolar electric probe that goes in to resect and cauterize the prostate. There is an absorption problem from the fluid that we use to visualize that can cause what they call TURP symptom, where enough fluids are absorbed and cause nausea, vomiting, and they cause basically a decrease in the sodium concentration in your bloodstream. There's also a significant amount of bleeding, and people would stay in the hospital for 2 or 3 or 4 days with a catheter and continuous bladder irrigation. But we've come a long way in the last, few decades. Development of medications like Flomax or Tamsulosin, Proscar, which is finasteride, that shrink the prostate and or relax the neck of the bladder to improve the voiding habits of the patient, have caused a significant decrease in the surgical intervention using TURP. Although they are not going to be as good as resection in terms of outcome, they certainly are very, very preferable to a lot of patients with high comorbidities for surgical intervention. And they are good medications, but like every medicine in the world, they are long-term medications that have side effects profiles that are not always pleasant or good for certain patients. So we got back to the drawing board and said, what else can we do to open that prostatic channel without some of these side effects we discussed with the older resection techniques? So things that came along like bipolar cautery, laser vaporization of the prostate, and there's also laser enucleation of prostate. But the biggest and greatest thing is what we're talking about today is the aquablation, or removal of the prostate tissue without using any heat. And I'll explain why that's important. Using that robotic assisted sort of process that uses a very, very high pressurized water jet at, believe it or not, 8,000 psi that goes in a sort of a sweeping fashion from about, if you're looking at a face of a clock, from 3 o'clock to 9 o'clock, back and forth, to resect that tissue or ablate that tissue. And we have to very carefully assess where we want that ablation to occur. Why that's important is because in all of these other procedures that use lasers and cautery that use electricity, heat dissipation is what has caused most of these men to have erectile dysfunction after those procedures. It doesn't happen to everybody, but I would say it happens maybe 20% of the time. And of course, a lot of folks don't want to have that side effect profile just to fix one problem. You don't have to sacrifice another problem. Mm-hmm. The other thing that's important is what we call antegrade or retrograde ejaculation. Normally, the bladder neck is closed when the ejaculatory canal that is right in front of the bladder neck and the part of the urethra that calls the prostatic urethra occurs. You have an antegrade or an ejaculation with pushing all that ejaculate out. When you open the bladder neck and you have a patent bladder neck, the ejaculatory stream goes into the bladder as opposed to going out the penis. And that sometimes, even though it's still climax, it feels different, and it's not necessarily something a lot of men would want to have as well. Those are the two big things that made aquablation sort of becoming the new standard of care for BPH and prostate resection. When you don't use any heat and you don't disrupt the bladder neck, you avoid those two big complications. You maintain antegrade ejaculation because you're preserving the bladder neck, and you also make sure that there is no heat dissipation to get into what they call a neurovascular bundle that can encroach on the erectile function of the patient after that procedure. I don't want to get too detailed, but the robotic piece of it is where you identify where you want the resection to start, where you want it to end. There are landmarks that we have to identify and sort of pre-plan. We make sure that we preserve that bladder neck. We make sure we preserve the part that's called the external sphincter to maintain, continence. And we ensure that we resect any tissue that we feel is going to be restrictive without being too penetrating into the external or the outside part of the prostate. And if there is any restriction that is caused by what we call a median lobe, like a ball valving lobe of the middle part of the prostate that can flop in and out of the bladder, that is also planned for, which is another thing that differentiates this procedure from other minimally invasive procedures, say like urolift and non-resective type procedures that can still preserve erectile function and antegrade ejaculation, but they don't remove tissue. They simply displace it out of the way. They're limited by the fact that you can't displace some of these big median lobes that are intravesical or in the bladder that are ball valving because you really can't push those lobes to the side very well or very effectively. And they're also limited by the size of the gland. If the gland is too big, then you're not going to be very effective, as those, again, are non-resective. They're more or less displacing or pulling that prostate tissue out of the way to open up the urethra. Where aquablation is a resective technique that is not limited by any particular morphology or really significant size of the prostate or intravesical prostate portion that's causing that ball valving restriction. You can still do all of those things and plan for them very accurately and very specifically. And once you have all that squared away, the robot does the work. You're obviously still watching what it's doing and can intervene at any time if you feel like it's not doing exactly what you want. But again, that's what makes this such a great standard of care improvement and becoming more and more the standard of care of choice for most men that want to preserve antegrade ejaculation and erectile function.
Well, I appreciate that very thorough and detailed explanation. I feel like I learned something from what you shared there. I was going to ask about advantages and benefits of this surgery in terms of patient outcome and recovery, but I think you've actually covered that. So I'll move on to the next question, which is the fact that Twin County Regional Healthcare is the first hospital in the region to offer this technology. The hospital serves a more rural part of Virginia, and access to care, and you alluded to this earlier, including specialty care, is sometimes a consideration for rural communities. With that in mind, I wonder if you can share your thoughts on the significance of having this level of care available to the patient population that you work with.
Every surgeon, every medical practitioner wants to give the most possible care to their community at home. Most patients don't want to leave the comfort of their home, their families, and travel very far down the road, especially at a moment of stress and discomfort from whatever illness they're suffering. So to bring procedures like that, technology like that, to the home front, to those communities, is a wonderful thing. We're very fortunate to be able to do so. Not everybody's going to be that fortunate. We happen to be in a rural or suburban area, but we have a fairly significant draw area from multiple different communities around Twin County, and it gives us a little bit of a unique ability to become a referral center to some of these folks, even bigger centers than we are that don't have this technology or expertise available to them. So we thought that would be, one, a great service to the community, and two, a reasonable way for us to continue expanding our services and provide services to other neighboring communities.
Well, Dr. Zaki, I want to thank you for being with us today and for sharing a little bit of your time. We're close to concluding our conversation, but before we let you go, we do have a tradition here on the podcast to close things out by asking guests a pair of surprise questions. To keep things interesting, we have a list of 10 mystery questions. So if you could pick two numbers between 1 and 10, I'll give you the corresponding questions.
7.
Okay. 7. If you could choose one superpower to have or any one skill to instantly master, what would it be and why?
As a servant of the people, I would hope I can heal someone and ease their pain. And that's because that's what I do for a living. That's what I've dedicated my life to.
It's a great answer. And then if you want to select one more number, sir?
3.
Okay, 3. What is the best piece of advice you've ever received, and why does it stick with you?
The best piece of advice I've ever received is to be flexible. It sticks with me because I'm very rigid. And I fail regularly at being flexible. And I think, unfortunately, being flexible is the key to surviving and continuously improve without feeling like you're being stressed unnecessarily. And I think that's a really important piece of advice, and I hope young people in every situation remember that and hopefully do better than I do with it.
Well, that's great advice. And also, listen, self-realization is the first step in the process, right?
Yeah, I have a lot of those. I just can't seem to act upon them.
Well, listen, I want to once again thank you for being with us and for giving a few minutes of your time today. And with that, that's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcast and subscribe so that you know when new episodes are available. And we want to once again thank our guest, Dr. Kareem Zaki, a urologist from Twin County Regional Healthcare, for joining us today. So thank you, sir.
Thank you, Joey.